from Channel 318 News. Here are your hosts.
Hi, I'm Allison.
And I'm Brandi.
Happy November 1st. Welcome to this special broadcast because
November is Pancreatic Cancer Awareness Month.
today we have a special guest with us tonight. Please welcome Dr. Sara.
Pancreatic cancer is one of the most serious of all cancers. It develops when malignant cells form in the tissues of your pancreas.
Now, Dr. Sara, what are some ways you can tell if you have pancreatic cancer?
Some symptoms of pancreatic cancer are upper abdominal and back pain, weight loss, jaundice, which is the yellow coloring of the skin, nausea and vomiting, diarrhea, and a loss of appetite.
Now, my grandmother had pancreatic cancer. Can you tell me how this affected her body?
Pancreatic cancer is when the pancreas cells cluster together and prevent the pancreas from doing its job.
The pancreas makes juices that help digest food. There are three parts to the pancreas: the tail, the narrow end, the body, the middle part, and the head, the wider end.
The pancreas, as shown in the picture, is a large organ that lies horizontally behind the lower part of your stomach. It also makes hormones that help control blood sugar, such as glycogen and insulin. These help the body use and store its energy it gets from food.
Pancreatic cancer is 30% more common in men than women. It is also more common in African Americans, people over the age of 65, people with diabetes, people who are obese or overweight, and people of the Ashkenazi Jewish descent.
Pancreatic cancer is the 9th most common cancer, and it is the 4th most deadly.
45,000 people are diagnosed with pancreatic cancer every year. This kills 38,460 people every year. 5 in every 100,000 people have pancreatic cancer. Please welcome pancreatic cancer survivor, Sara.
Hi, I have some ribbons.
Thank you.
Thank you.
Thank
You're
you.
welcome.
So, Sara, how were you diagnosed?
I was diagnosed by a CAT scan. The doctor used an x-ray machine with a computer to take pictures of my pancreas and organs near it. That's how they saw the tumor.
Pancreatic cancer can also be diagnosed by an ultrasound. The ultrasound machine is placed on the person's abdomen. It then sends echoes that bounce off the person's pancreas to show a picture of it.
Some other tests that are done are an MRI, PET scan, needle biopsy, EUS, and blood tests like a liver function test. So Sara, what caused your pancreatic cancer?
I was a smoker for 25 years, which made me 2/3 more likely to get it. I also had hereditary pancreatitis and cirrhosis of the liver, which made me even more likely to get it.
A person with a diet of processed meat, fatty foods, and they would be overweight, and they would be exposed to metals and petroleum, have an increased risk of getting pancreatic cancer.
Some diseases that give people a higher risk of getting pancreatic cancer are non-polyposis colon cancer, familial breast cancer associated with the BRCA2 gene, familial adventitious polyposis, and peptic ulcer disease.
Now, Dr. Sara, since my grandmother had pancreatic cancer, is it possible for me to inherit it?
Yes, but only about 10% of cases of pancreatic cancer are hereditary.
So, Sara, how was your cancer treated?
My cancer was treated by the Whipple procedure, where they removed the head of my pancreas, which is where the tumor was. I also had my gallbladder and common bile duct removed as part of the surgery. The surgery was very successful, and it was followed by chemotherapy.
Chemotherapy is very common. It uses drugs to kill cancer cells. Some side effects are hair loss, easy bruising, loss of appetite, and feeling weak.
Another form of treatment is radiation therapy. It comes from a big machine and uses high energy rays to kill pancreatic cancer cells.
A treatment was recently found. It is 2 vaccines that are used together to extend a person with pancreatic cancer's life. It can be extended by a few months, and it isn't toxic. Pancreatic cancer can be prevented by
Not smoking.
Eating diets with little fat and meat and eating plant foods.
Keeping a healthy weight.
and exercising regularly.
And down.
Thanks for watching this special broadcast of pancreatic cancer. I'm your host, Allison.
And I'm Brandi.
And I'm Dr. Sara.
And I'm Sara.
Remember to wear your purple.